You're listening to Well Within 10, a bite-sized approach to working on your wellness. 10 minutes of wellness thought leadership from experts across the country, hosted by me, founder and CEO, Stevi Carr. Today, we'll be speaking with Dr. Sarah Kale, a doctor of physical therapy looking to make a difference in health and well-being of people in her community. She loves to educate patients to empower them in taking control of their health and reaching their goals through including those with acute and chronic orthopedic conditions, pelvic floor dysfunction, and neurological conditions. Sarah, welcome to the podcast.
Hi, Stevie. Thanks for having me.
Oh my gosh, thank you so much for being here. What are we going to be chatting about today?
I wanted to chat with everybody just to bring some awareness to the realm of physical therapy as far as pelvic floor health. Talking a little bit today about how that's affected with the aging population, specifically women, and the things that we can look at to improve overall health and quality of life in women.
I love that. I know that we're, amidst discussing aging here at Wise Wellness Guild this month, and really excited to dive in. And this episode is powered by the Anchor Wellness Center, founded to challenge the way health and wellness services are delivered. As a Cincinnati-based integrated health collaborative, they're rooted in the principles of evidence-informed collaborative care of highly specialized providers, just like Dr. Sarah Kale. So Sarah, I'd love to chat a little bit about, how as we age, how do things shift for us? I know that I just turned 36 and I am definitely noticing some changes and would love to just hear from you on what you're kind of seeing and how, as we talk about sexual wellness and talk about pelvic floor, what are some things that we should be looking for and how can we kind of adapt as we age?
Well, number one thing that I'm surprised most people don't realize, and you know what, I don't even know if I knew until I was a PT and went through PT school, that the pelvic floor is just musculoskeletal tissue. So it's just the same as the muscle that is in your bicep or in your quad muscle. It's a very similar tissue structure. It functions a little differently than those musculoskeletal tissues, but that's why as a pelvic floor PT, it's within my scope of practice to treat those areas. So as far as, if you think about we know that we peak in our strength, right, in our 20s, and that's great. We all know that I think a lot of us are concerned with that initially just from a aesthetic standpoint, which is
Sure.
fine. But, as a PT, I look a lot more at the function. So as we age, we lose we lose muscle every decade. So we're gonna be losing some strength, particularly we can see that as far as the pelvic floor goes too. So you're gonna see some thinning of the muscle, especially as women reach menopause. They're gonna get more, of course they get some dryness and thinning of the walls of the vagina, which affects some sexual function, but also as far as the pelvic floor muscles, those muscles are going to thin as well. So that's going to affect strength. And then as women feel that strength is decreasing, I think a lot of times they're trying to hold on and they're not quite sure because they're so unaware of what's going on with those muscles. We can't see them. So it's so hard to know what's going on down there. So then people kind of start clenching their rear end and holding on tight. And then so you get this cycle of pain and weakness down there. And, I think a lot of women are not aware of that's muscle and that it can be treated by someone and that there are physical therapists that help treat that.
Yeah, absolutely. And we know that this is beyond, just normal aging stuff too. There are things in life moments that can really impact that. I know that, if you, have had a child or certain surgeries or things that have happened, it can exacerbate issues. If you, exercise certain ways, or people that live decades with hernias and never even realize it. So would love to, dive in a little bit. What are some things that people can be on the lookout for that might not be normal, average stuff that they might want to come in and check out with you?
Right. So, a lot of people think as moms, it's normal to have some of these problems. Like, you give birth, you become a mom, and all of a sudden it's like, well, I'm a mom. So now this is just what I have to deal with. So things like leaking urine, incontinence, painful sex, just kind of general pain in the pelvic area, the SI joint pain. Also, we see diastasis recti, so that's like the separation of the abdominal muscles. That's not specifically related to the pelvic floor, but again, that kind of goes in with the
Yeah,
whole
absolutely.
core that we're looking at as far as treatment goes. We also see some pelvic organ prolapse, which is generally you kind of feel like a heaviness down there, kind of dragging or bulging. That's what you might feel if you are having some symptoms of pelvic organ prolapse, which just means that the organs of the pelvis are descending down. Gravity's taking them down a little further than they should go.
I think that that's so important to really, push people into some different thinking of this isn't just about pain and sex as we age and some of the challenges we're having there. It's not just about adult incontinence and urinary continence. It's about a whole quality and value of life, that there's a lot of pieces that even if it's been 20 years since you've given birth, there's still things that you can do to improve,
Right.
in that space. I think that's so crucial. That's awesome.
Right. Yeah. And right now, one of the things that the industry is trying to bring a lot more awareness to getting postpartum treatment of the pelvic floor for postpartum women. So making that more standard care, that you would be referred to a pelvic health PT. And I think in some parts of the country and maybe even like Australia, they're really big, they call them physios there, but they're really big into doing those sorts of things. Whereas, like in the Midwest, we're in the Midwest here, it's not quite as common for that. But, I think there is a little more awareness now, at least. But looking back at, my mom's generation, especially my grandmother's generation, that, that wasn't even really a thing, but they, you're talking about women who, you're seeing now in the menopause age, which we're talking about, that decrease in estrogen is certainly going to cause some musculoskeletal issues, as well as we know also causes some of that thinning, dryness, those problems. But these women who maybe had babies 40 years ago, who maybe had a tear of the pelvic floor muscles and it's never been looked at or addressed at any point, now we're looking at that muscle and maybe they've made compensations over the years, which is giving them, problems elsewhere. But then you're getting these new problems that are arising because the muscle's just not holding up the way it used to, right?
Yeah.
So sometimes, even though maybe they never got the help they needed after childbirth, but they, now are seeing those problems getting bigger, or maybe they've always had a little leaking or a little heaviness, but they just ignored it because, they had children to raise and jobs to go to, and
or they didn't know any different, right? Like they were
and
like, this is just how it is. Yeah.
Again, part of being a woman. And I think, I've heard women come into be treated for other things who've said, oh yeah, I have pain with sex, but that's just part of getting older, whereas it's like, well, if it was just part of getting older, then everyone would be having that issue, right? So there are a lot of things that we can look at. And I guess, I would say there, we all know there's lots of things that you can do, but just again, thinking about these things as not being just oh, there's nothing I can do about it,
Yeah.
So, and just getting into that more mindset of, okay, there are people that can help me with this. There's a lot of research on this. There's level 1 evidence, which means there's a high level of research to support getting pelvic floor PT for pelvic pain, for incontinence, for organ prolapse. Those things all have really high level of research to support getting pelvic floor PT.
I love that. I think that the takeaway here is that, you don't have to live with pain. You don't have to live with discomfort. And if you have a question, you have people like Dr. Sarah Kale from Anchor Wellness that can help support you. So thank you so much for coming on the podcast today. If you have any questions, make sure you check us out at shop.wisewellnessguild.com, and Anchor Wellness, Dr. Sarah Kale will be on there with a full blog post that you can learn more about how to make an appointment with her. Thank you. Have a good day.
Thanks, Stevi.
You've been listening to Well Within 10, a bite-sized approach to working on your wellness. You can find more episodes wherever you get your podcasts.